Hello all. So we can discuss the next set of questions in this video. Okay. So the 11th one, increased cardiac output. Okay. So first of all we have to know what is cardiac output. Okay. Cardiac output means the volume of blood pumped by the heart in a 60-second interval. Okay, within 60 seconds how much blood the right ventricle is pumping, how much blood is pumping, so that is called as cardiac output. Okay, so within a minute how much blood is pumped by the ventricle, that is called as cardiac output. And if you know the cardiac output, and through that way we can assess the blood circulation in the body. Okay, so the blood flows around the body, we can assess by the cardiac output. So in which all the conditions we can see the increased cardiac output. So when the cardiac output increases, there will be increased blood flow will be happening, and through that way increased blood circulation to the organs will be there. Okay, like too much of blood is in 1 minute, there will be too much of blood will be entering into the aorta, and through that way the blood pressure will be increasing. There is too much of blood is entered into the aorta, so there will be increased blood pressure will be there, and through that way increased blood flow to the tissues also will be happening. Okay, so in which all the conditions we can see the increased cardiac output is anxiety. Okay, anxiety. Then eating. Whenever you are eating, that time also increased cardiac output is there. Exercise. Okay, during the exercise also there will be too much of blood will be entering into the blood vessels, and there will be increased blood flow will be there. High environmental temperature. High environmental temperature. Then in pregnancy, then intake of epinephrine, and whenever you are having histamine in your body, histamine secretion in your body, that time also increased cardiac output is there. Okay, these are the conditions where you can find increased cardiac output: anxiety, eating, exercise, high environmental temperature, pregnancy, epinephrine and histamine. Okay, so cardiac output decreases also there. Okay, so they used to decrease in sitting up or standing from lying position. Sitting up or standing from lying position. The patient is lying down, then after that suddenly the patient is sitting or standing. In that time decreased cardiac output will be there. Then rapid arrhythmia, heart disease. Okay, so in these conditions the ventricle will not be pumping blood properly, so because of the decreased cardiac output will be getting. In two conditions you will not get any sort of changes. Okay, during the sleep there will be no change in the cardiac output, increase or decrease, nothing will be there. Moderate changes in the environmental temperature. Moderate changes in environmental temperature. So in these two conditions there will be no change in the cardiac output. Okay, so these are the conditions where you can see increased cardiac output, decreased cardiac output, and there will be no change. Okay, how we can calculate cardiac output is the stroke volume into heart rate. Okay, stroke volume is how much volume of blood you are pumping from the right ventricle. Okay, how much blood you are pumping from the right ventricle or left ventricle in 1 minute. Okay, stroke volume into heart rate, that is called as cardiac output. So stroke volume is 70. Okay, 70 to 75 ml is the stroke volume. Okay, so in each ventricle this much blood is pumped. Okay, 70 to 75 ml of blood is pumped from the each ventricle. Okay, and heart rate is 72. Okay, so 70 into 72 will be coming 5 liters per minute. This is the normal cardiac output of human beings. Okay, especially males. 5 liter per minute, that is the Normal cardiac output. Then next question. Next question was a BPH patient who has done urogram. Then after 1 week they have got macroscopic hematuria. Okay, macroscopic hematuria means the blood will be visible in the urine. Okay, with our naked eye we can see that. So that condition is macroscopic hematuria. Okay, so after doing the urogram, if you have got macroscopic hematuria, what advice we can give? Okay, so first of all, urogram, so that is used to examine the kidney, ureter and bladder. Okay, these three parts we are examining through the urogram. So it is a type of X-ray. We are introducing a dye into the patient's body, and through that way we are taking the X-ray of the kidney, ureter and bladder, and through that way we can identify if any problems are there in the kidney, ureter and bladder, so that we can identify through this urogram. Okay. So usually we are inserting a dye. So some people they will be having allergic to the dye. So because of that you can get some complications. So before doing the urogram you have to do blood test. If any allergy is there or not, we have to check it. Then after that only you can go for the urogram. So after, if a BPH patient, if he have done urogram, then after 1 week he have getting macroscopic hematuria. So macroscopic hematuria, it is indicating that there is a severe problem has happened in the kidney. Okay, kidney failure. So the patient, the advice we can give is immediately the patient has to meet the doctor. Okay, prompt medical attention is required whenever if you have seen macroscopic hematuria. Macroscopic hematuria, it is not a complication of urogram. So it is indicating there is a severe kidney failure. So immediately you have to go to the hospital. Next one is fertility vitamin. So option vitamin E is the fertility. It helps in the fertility vitamin because vitamin E is essential. The main function is the antioxidant property is there. Okay, so the main vitamin which helps in the fertility is vitamin E. Next one, it was vitamin D. Okay, what is vitamin? They have asked the question. It is a hormone, vitamin or enzyme, like that options they have given. If the vitamin D is a vitamin, but it has a resemblance of hormone also, and it has an action of enzymatic action also they are having. So if option all of the above is there, then you have to choose the option all of the above. Okay, so the next one. So while wrestling due to jerky movements, all type shoulder movements are restricted. So the diagnosis is clavicle fracture. Okay, so in clavicle fracture, you will be getting difficulty to moving the arm or shoulder. Okay, because of this wrestling, they will be giving a very big force to the shoulder area. So you can get difficulty in moving shoulder, like shoulder movements are all restricted. So the answer will be clavicle fracture. So rest of the questions we can see in the next video. If you found out it is beneficial or if you liked it, please like, share and subscribe this channel for the more videos.